Hopefully that's coming through okay. So yeah, thank you so much, everyone. My name's Tara, and I'm a wearer of many hats nowadays, but today the hat I'm wearing is my DHI hat. So I support work within the Digital Health and Care Innovation Centre around the care and well-being portfolio that has been developed within DHI. And also, I'll just pass to Freya to introduce herself as well.
Hi
Thanks, Freya.
everyone. Hello. Yeah, I'm Freya. I'm a designer and researcher at DHI. And yeah, I don't know, simple introduction. I'm kind of working with DHI part-time and kind of focusing on this project around the Care Hub at the moment.
Thanks, Freya. So this morning we are really keen to hear from you about a piece of work that we're looking to launch in December. That we have been working in partnership with many colleagues across Scotland, including Nikki from the Care Inspectorate, around how we can launch a digital care innovation hub. Now, I will say at this point that the name may change. We are still searching for a catchy name, so if anybody has any suggestions, they are most welcome. But really, this work comes from, I'd popped a link into the chat just before I started sharing screen. Within DHI, and if we think about innovation across Scotland, over the past 10, 20 years or so, there's been a real focus on health. And, innovation has really expanded within digital opportunities that are available within health services. There's been a lot of investment and focus on digital within health, but within the work of DHI, they have been expanding their portfolio to be much more focused on that wider care and well-being, and where digital can really play a strong role in prevention and early intervention. And last year, the Scottish Government commissioned DHI to develop a care and wellbeing innovation portfolio and to focus in particular on social care. And over the past almost couple of years, this work has been led by Professor Margaret Wariski within DHI, and has involved engaging with over 20 national organisations across Scotland. And within that work, we were really keen to hear about what innovation is already happening in social care, also including social work and housing within the scope of the work, to really map that landscape. Because I think in Scotland there's a real challenge with, because the focus has been so much kind of dominated by health, there hasn't been that same strategic priority and kind of cohesion of looking at digital innovation across social cares. So we find that there are lots and lots of innovations happening. People are making investments in digital, and but it's more kind of, there are pockets of things happening across, and there's not really any one place where we can kind of pull all of that together to support everyone to learn from that, and also, to help make that investments going forward in their organizations. So we did some work doing lots of engagement and doing lots of review of different projects to understand the to get a real understanding of the challenges, but also where there are opportunities to potentially scale innovations within social care so that we have, much more widespread and mainstreamed. But within the work, where in health we have the ANYA pathway, which is a pathway that focuses on how to scale and spread innovation across health. Anya doesn't currently focus on social care. It is specific to health, so there isn't really the same infrastructure across the wider care landscape to support that innovation pathway. Similarly, within entrepreneurial opportunities and looking at that kind of industry relationship, again, there are not a lot of opportunities for the sector to be really engaged in that space. And also, when we look at financial investment, just quoting some of the UK government numbers, when we compare the investment in health to social care from the period 2023 to 2025, social care investment in digital innovation was just over 40 million, and that's compared with just over 180 billion is invested in health and digital innovation. So there's no parity in terms of that investment within social care. So the other thing that came up in the engagements was around, that evidence and learning about the impact of digital innovation in social care. There's a lot of work that's happening and a lot of evaluations are being produced that really shows if it were to be invested in as a part of that kind of prevention agenda, then actually the cost benefit of investing in digital technology within social care. I'm thinking of the care technologist work led by Scottish Care. I think their cost benefit ratio was at a minimum £4.50 to the pound. So, but actually all of that evidence and evaluations again are kind of held in different organizations. So there isn't one place for bringing that all together. And as I mentioned before, that kind of lack of cohesion and strategic leadership around digital innovation in social care. So in reflecting on all of those challenges, and as I say, working together with all of the partner organisations across Scotland. And this diagram on the screen just has the logos of all the different organisations that were involved. One of the priorities that has come up is around, okay, how could we create a hub and map out what that innovation pathway should look like if we're going to, bring that parity that we see in health for social care as well. So within this work, we are really keen to look at how we can start to create the conditions for understanding what that innovation pathway looks like in social care, providing a place, a virtual place where people can come together, can knowledge exchange, can learn from each other where innovations have been happening, trying to collate all of that evidence and best practice examples around the digital innovation that's happened in practice and where there are potential opportunities to scale that, thinking about what types of resources we could create that can then help across the sector to think about that sustainability and scalability of digital innovations in social care. Also looking at opportunities that are coming up in new technologies, how do we kind of keep a finger on the pulse of all those developments and actually support much more engagement with industry? Because we, as part of this work, have also had an event to engage with industry partners to also hear from their perspective when they are thinking about, designing solutions that are specific to the social care sector. And from their perspective, they're really keen to understand more what they could be doing in terms of their design and developments to make sure that the solutions they're coming up with are also tailored to social care and meet the needs of social care. But really trying to provide, as I say, that cohesion and coordination across, what has been sort of quite a scattered landscape of activity over the past number of years. And again, within DHI, we also have a small team that focus on digital skills. So also working with them to inform and influence, how that kind of future digital skills can be supported as well within the work that they are doing. So really trying to also maximize on, DHI is an innovation centre for the whole of Scotland, but as I say, really they want to invest in social care and how they can really focus activity around supporting innovation in this landscape. So that's where this idea of developing this hub and this innovation pathway has come from. But we are really keen, sometimes even I can be a bit skeptical with all my optimism on, I'm very keen that this is not just another hub or another innovation thing that comes about. We really want to make sure that this is meaningful for people and that it actually, we can um, focus on things that actually make a difference to providers in practice. And that's why we were really keen to have this session today. And also we've got some follow-on focus groups as well to take us kind of deeper dive into some of these areas, because we really want to make sure that what we do and where we're able to kind of prioritize our efforts, that it can actually it can give back impact to the sector and to providers. So that's why we're really keen to hear from you today. We only have a limited resource that's available to us at the moment for this work. So it's, where do you feel we should really target and focus that, so that we can, come back in a year or 2 years and say, okay, are we meeting your needs? Is this doing what you thought it should do? And sense check with you if it's actually, making a difference to the work you do. Very much being aware of the pressures that are that exist across social care at the moment. So it's, how can we add value? How can we do something that's useful? As I say, which is why we're really keen to hear from you. So Freya and I are going to lead you through a little Slido. I'm not sure if you've used Slido before. If you have another device handy, you can either pop onto it on if you have a mobile phone, you can just go to slido.com, or on your screen, if you want to open up your browser or open up another tab on your browser and enter slido.com. And then if you enter the code hashtag 40744484, should hopefully lead you to a set of questions there. Hopefully that is coming up for people. So the first thing that Freya and I are keen to hear from you about, and sorry, there's a lot of questions here, but Freya has framed these. Within design, we often write things as a what if, because these are absolutely all optional things we could focus on when we're thinking about this hub and what could be delivered as part of this work that we're doing. But really keen to hear from you the top 3 activities that you feel are most important related to delivery. So on here we've got things about, research and innovation. We've also got, if we could create a pathway to really guide what that innovation should look like in social care. What if we focused on that? Would that be helpful? thinking about the parity, if we, really invested all of our energy in that, or thinking about the how we bring together providers and industry to really kind of help shape, influence, what that future market could look like in terms of technologies that become available. If we focused on resources, would that be helpful? So, as I say, if you want to have a look through the options on the Slido and then select your top three. And I'll come to Freya.
Yeah, we're starting to get a few people coming through now.
Brilliant.
So I can, yeah, if you'd like, I could share.
Sharing and let you share.
Yeah.
Your
So I
screen.
can give you a little picture of what's starting to come through just now. So yeah, it seems like accessible resources are really high up at the moment, as well as a pathway to guide digital care innovation and parity for digital and social care, and social work as well. So yeah, that's the kind of top three that we're seeing at the moment. And yeah, we'll leave this up for a moment while you'll kind of still come through.
Yep.
And also, if anyone has anything that they want to kind of expand upon, feel free to kind of comment in the chat as well if it's sort of sparking any thoughts for you as well, and we'll keep an eye on that, and kind of let you know.
Excellent.
So we can just give a couple more seconds to this, and then Tara, do we want to move on to the next one? What feels good? Yeah.
Bring up the slides again. Hopefully that is changing over now. So the other thing we've been thinking about is, and as I say, everything that we're, has come up is not just Freya and I sitting and thinking, oh, what could we do? This has absolutely come from, all of the engagement with those national organizations, and through that kind of research that we've been doing. So thinking here about the functions specifically, so how the hub could work. So we've been thinking about what we've been hearing from the work is around potentially developing a framework for digital care innovation, much more focused on outcomes for people. Because obviously that's a huge part of social care and the work that you do. That collaboration and knowledge exchange, providing opportunities for people to come together, and as I say, making those links with industry, potentially research as well. How can we, I suppose I think about, I previously spent a lot of time working in academia, and I think about the way in academia how it works. It tends to, review a lot of the, previous research that's out there, and then you're identifying where could your next research focus on. But it would be great if we could be much more influential to academia and research by through collaboration and knowledge exchange, and actually feeding in, this is what, we need research and industry developments to focus on. Kind of could the hub give that center place for advice, information, action? Certainly, again, from some of the providers who also joined the industry engagement event, were telling us about how difficult it is to know what to invest in, particularly if you're from the independent care sector and you're looking to invest in, digital care planning or digital tools within the work that you do and the support that you provide. How do you know, how do you make that decision, and where do you go to to get advice and information and to kind of help guide that decision making around investments. As I say, engagement and that leadership role as well. So being able to then feed back into policy and decision makers around, directions to be going in terms of digital for wider care. So those were some of the ideas that came up through the work in terms of how a hub could function. So again, hearing from you, the top 3 would be great. And I can stop sharing again and pass back to Freya.
Yeah, and I've moved on the Slido, so we're again starting to see some results coming through on that. So I can just share with you what we've got so far. So yeah, a centre for trusted advice, information and action seems to be a really important and popular one here at the moment.
Great.
We also have a single place for hosting up-to-date information about digital care innovations. And it's swapping around as we go. Frameworks and processes, models to support development, implementation to evidence and impact. So quite interesting seeing it shift around as you'll kind of join and move on. So it's seems like there's a lot of equity in kind of the important things and how the hub should function. So
yeah, great. And just picking up on comment in the chat as well around that accessible, relevant resources for digital skills and literacy. Yeah, because we know that I've been involved in wearing one of my other hats. I'm involved in some work around digital inclusion and, how that's not just about how we support people to access digital services and supports as part of their care, but also equally how we support our workforce to be to feel confident and to feel skilled in supporting people to access things digitally as well and using digital in their work. Absolutely. And thanks, Candice, for the link there to NES. So we're also linked in with NES through this work. Again, we're hoping that they will be a key partner as we go forward as well around skills support.
Great.
Thank
I'll
you.
just stop sharing this now and I'll leave it up for a couple of more seconds whilst we just get the last results through, and then Tara will introduce the next one and I'll move on the thing. So yeah.
Perfect. I'll just go back to the slides. So finally, we've got these kind of processes that, again, the hub could support with. So we've got some ideas, again, that have come up from the work around what types of things the hub could focus on and prioritise. So thinking about, again, how do we support that collaboration or collective? If there are particular challenges actually everyone faces that digital could play a role in supporting, could we facilitate some collaboration around some, big juicy challenges that we need to look at, and again, really be guiding where, digital solutions could be developed. Thinking about those opportunities for future research and innovation, that evidence synthesis, again, that links back to how to evaluate, decide, and invest in digital innovations. So again, pulling together a kind of evidence base, and equally to help develop business cases, or if you're within your organizations, if you're part of a larger consortium looking to put forward a business case to invest in something, would an evidence base be helpful where you can, go to a single place like the hub and actually draw from the evidence that's available from across Scotland, and potentially internationally as well. DHI has a big international network too. So learning from other places. Supporting that involvement in the innovation process, showcasing good practice. As I say, these are some of the ideas that have come up through the work so far. Again, I can, if everyone's had a chance to have a look at those and come onto the Slido.
Yeah, we're starting to see some people coming through here. So I can share some of the results as we're seeing them. Here we go. So yeah, currently the top 3 we have are showcasing good practice, collectively tackling challenges and co-creating solutions, and if collaboration was better supported between industry and care providers. So yeah, that's sort of shifting around a little bit, but seems to be sort of staying at the top 3. I also spotted a comment in the chat, which I can't see just now, but Tara,
from Lynn, yes, for the public sector collaboration with third and independent providers to access and implement digital solutions jointly in communities. Yep, how can we really coalesce efforts? Because we are all here to support people who access care and support, and so how can we make sure that we're doing that collaboratively when we're thinking about digital solutions? Absolutely. Thanks for that, Lynn.
Definitely. So yeah, I can leave this up for a few more minutes, but it looks like a good portion of people have shared their input. So I'll, yeah, stop sharing, but I'll leave the Slido up for a minute.
Perfect. And then just the final slide we had was, yeah, what are we missing? Because we probably haven't covered everything. And as I say, we are a very, very small team, but we are so lucky to work with, partners like Nikki and others across the national organizations. So we will be, we will have to prioritize what we can focus on in the first kind of launch of the hub and what we kind of focus our efforts on immediately, but we won't lose anything. And if there are real gaps you feel we're missing within some of these things around what we could deliver, how the hub could work, and what those different processes could be that we try and support. If there's anything that you feel that we haven't included or that you thought you would be reading on the screen there or that we would be talking about that we haven't, please do let us know, because we'll absolutely capture it. And as I say, we'll use what you've told us today to take a sort of deeper dive in the focus group sessions that we have, but feed that into how we then start to prioritize what we'll be able to focus on sort of in the immediate launch of the hub. And sorry, I should say the hub is going to be launched at the DigiFest conference, which is taking place on the 11th of December in Glasgow. So that will be the kind of formal launch. And we're working on the kind of governance aspects around the hub at the moment to get that all set up and ready for launch in December. I'll just check, Freya, if anything is coming in the chat.
Nothing so far.
Missing.
Yeah, nothing so far, but we'll keep an eye. Good. So if anyone does put anything in, we'll make sure to capture that.
Yeah. Brilliant. And the very final slide is just in case you weren't familiar with DHI. There is obviously got the website, and we have a newsletter as well that you can subscribe to, the various social media channels that DHI is part of as well. You're very welcome to subscribe and be part of be part of DHI too. But as I say, we're working. We have a session next week to really start to focus on the detailed plan of what we'll do in the hub work. And you know, Nikki is part of the group working on that. So we'll definitely be keeping in touch as this evolves and develops over the next while. And it would be great to come back at some point and, as I say, check in with you. Is what we're doing actually helpful? Because, you know, we really do want to make sure that this is something that brings value to you with the work that we do. That's really, really important. So I'll leave it there and just stop sharing in case check in on the chat.
Yeah, I think we've just got one comment in here from Shannon talking about getting everyone on the same page, specifically relating to the health and social care renewal framework and how mainstreaming of digital inclusion support needs to happen across health and care. But kind of what does that look like, and making that a bit more tangible. So that seems like a really interesting point to kind of highlight and capture.
Absolutely. And it's kind of, how do we collectively define that? And as I say, that kind of role of the hub in then influencing back into policy frameworks and the work that policy then takes forward. You know, how can that be a mutual two-way thing? Definitely that would absolutely link with that point as well.
Yeah. I know that's some of the feedback Candice and I have had from working with social care providers as well, testing our toolkit just about, you know, that sort of synergy with commissioning models as well to really support that digital innovation in the sector. So that seems to be a theme, doesn't it? You know, just based on some of the feedback you were getting there, just that collaboration and bringing everybody together. And I think that was highlighted in some of the scoping work from the workshops around the kind of fragmented nature of the kind of landscapes. Is something to bring that together with all stakeholders, I think would really help. But that was excellent. Thank you so much.
Thank you very much for having us. Thank you.
Yeah, no, pleasure. It's always, I think it's so uplifting to hear about something like this at this stage when you're thinking about the possibilities, you know, what it might mean. So, and some of the, you know, the investment figures you highlighted as well are quite stark, you know, really shouts out at people. So lots of kind of initial feedback there about resources and skills and things like that. So really look forward to continuing the conversation through the focus groups as well that we've got set up. Candice, I don't know if you want to share the slides we've got on that, just so people know how to sign up and get involved.
Brilliant.
I will do, Nikki.
And I can mention as well, Candice, that with the focus groups, just to mention that our initial focus with the work will be on adult social care. So just to highlight as well for the initial focus within the hub, just to mention that as well. Thanks.
Thank you, Tara. Yes, so if anybody wants to be part of this exciting opportunity to have the voice of the sector heard, please scan the QR code. It'll take you to a Microsoft form. And then if you could just choose which session would best suit you for time-wise, either the one in the afternoon on the 12th of November or the morning of the 13th. I specified sector in there, but as Tara has just said, it would be focusing on adults. But if you could maybe specify if you're an adult care home or care at home or what part of the adult sector, that would be really useful. Spaces are limited, so once we have everybody in, we will then send you out an email with how to register for the event. So yeah, please do get in touch. Joining the focus groups will be your opportunity to be part of that deeper conversation with Tara and Freya. I'll leave that on for another second, but I'll come back to it. But I just wanted to share one more thing. As you know, we have our own digital social care hub with a Care Inspectorate as well. So if you wanted to keep up to date with upcoming events, changes, new guidance coming out, you can sign up to our mailing list, which is on our hub page, for the Care Inspectorate hub page. But you can also find a list of different resources. Someone spoke about different resources for their staff. So that's where we keep up to date with current resources and guidance. So yeah, do visit our hub page if you want to get any information in the meantime. I'll just go back onto the QR code and leave it on there for you if you want to scan for the focus groups. Yeah, that's all for me. Does anybody want to come off mic and say anything? Does anybody have anything they want to add before we finish off? We'll give you some time back because I think that's us all wrapped up, which is very rare for our webinars. We're always running to the minute, so I'm feeling quite proud of us.
Yeah. Please get in touch as well. We've got obviously our webinar series runs quarterly, so we'd love to hear from you. It makes such a difference, and I think the impact is greater when we get people from the sector talking about, you know, things you're doing with digital improvement projects, things you're struggling with, projects you've taken on. Please get in touch, and yeah, we'd love to hear from you to showcase, you know, some of the practice that's going on out there. So.
And I've popped in my email as well, Nikki, if anybody wants to get in touch, and Freya's email is there too. You know, please, very welcome to get in touch, and yeah, happy to have any kind of follow-up chats as well. It's great. And yeah,
Okay.
just can't thank everyone enough. As I say, it's so important that we hear and listen to what you feel are the priorities, so that we can, as I say, try and make this as meaningful and valuable as possible, given that, you know, there's a real opportunity to do some great work in this space. So, but the most important thing is we make it practical and useful. So really appreciate everyone's input. Thank you very much.